Great. I found today really, really interesting. What I found fascinating is there's lots of short presentations, but the commonality across those presentations, the themes coming through are really unified. And actually, they don't relate to the technical medical stuff. They relate to the much broader social, psychological, environmental things, which is so important for healthy aging.
Yeah, I agree. I've really enjoyed today hearing the different perspectives, like the different disciplines. We've had, researchers, clinicians, GPs, psychologists, pharmacists, and all, talking about healthy aging from these different disciplines, from their different experiences. I think collectively, if you put it all together, kind of have a solution for how we can age in a really healthy way. Yeah, it's been great.
Everyone's just so passionate. I think I've always been really interested in human connection and community, and I've always understood the importance of it. And then being a doctor myself, I knew there was something more that was there when it comes to caring for people and being a doctor. So it was amazing to have all these speakers come and give evidence of how loneliness is connected to your health and a patient's well-being, and the opportunities available there to provide that holistic care to a patient. So I've just been I feel really grateful that I've got to learn all of that. And if anything, I feel more aligned with my direction of my career as well, by knowing that there is actually a purpose out there, and that actually improving someone's loneliness and social connection is really going to prevent them from having these cardiovascular risks or mental health risks, and bringing the community together is something that I want to do while healing as a doctor as well.
I found today very insightful. I learnt a lot about all the other initiatives, and because I'm not a clinician from a medical background, I learnt a lot about what's on offer.
I really learned a lot about the question of agency and the significance of agency in the aging process. That gave me some cause for hope, actually, that a lot of the intractable problems that we're facing might actually have a path forward.
Today was a really informative and collaborative day. Really appreciate being part of it. So many connections, I think connection's the word, that came out of today's session. So thinking about how we get older people connected with the right services, how we put them at the centre of care, the patient-centredness, and how we get a whole lot more social engagement and opportunities, whether it's around food, nutrition, pharmacy, exercise. All of those areas are important, but that connection is just really critical, really come out of today.
Okay. Must say I was really grateful to the Nepean Blue Mountains PHN for organising the Healthy Aging Conference today. I think it has really helped me in identifying issues relating to ageism, and in particular just giving some more thought to the whole concept of social prescribing in enhancing health outcomes for older people. So just so much food for thought after today. And Norman's one just adds so much cohesion to the content of the day. Just a real pleasure to be present.
Thank you. The Healthy Aging Conference 2025 was absolutely amazing. Worth the trip down from the Gold Coast to Penrith. We had fabulous speakers. The content was amazing, so informative. I'm going back with more energy, more vibe. I'm just going to make hopefully health better for our population. And I loved hearing so much more about the holistic approach to care. So thank you for having me.
Really enjoyed today. We had some amazing speakers, and really found this reoccurring theme of agency and patient-centered care helpful in thinking through how we approach and treat our patients. So really enjoyed it, and it was fantastic to be a part of it.
Okay, today was a fantastic way to find the way that we're missing the links in community with helping older Australians do a better job of connecting and improving health for our older Australians. And the speakers were fantastic, especially Dr. Norman Swan, who's one of my heroes. Thank you very much, the PHN, for such a great presentation. Thank you.
Today was a fantastic event. I really loved the variety of speakers, and the fact that a lot of the presentations were really thought-provoking, evidence-based, and also really highlighted the importance of prevention different medical models, and also that we need to be looking at patient-centred care. And I think that came through in every single presentation. It was a great day, and feedback is that lots of people have really enjoyed today.